Hey friends, welcome to Nursing Online Education. In this video, we will be discussing important question and answers of different nursing comparative examinations. Guys, let's get started. Here is our first question.
1. Oman was restless and observed to have an increased physical activity after a heated argument with another person. After the assessment, the following data was gathered: agitated, diaphoretic, distorted. What is the patient's level of anxiety? A. Mild, B. Panic, C. Severe, D. Moderate. The answer is option C, severe. 2. A client is admitted to the emergency room with renal calculi and is complaining of moderate to severe flank pain and nausea. The client's temperature is 37.8. The priority nursing goal for this client is A. Maintain fluid and electrolyte balance, B. Control nausea, C. Manage pain, D. Prevent urinary tract infection. The answer is option C, manage pain. 3. Which of the following ECG findings indicates MI? A. ST depression, B. ST elevation, C. Short ST, D. None of the above. The answer is option B, ST elevation. 4. A client has been newly diagnosed with hypothyroidism and will take levothyroxine 50 micrograms per day by mouth. As part of the teaching plan, the nurse emphasizes that this medication, A, should be taken in the morning, B, may decrease the client's energy level, C, must be stored in a dark container, D, will decrease the client's heart rate. The answer is option A, should be taken in the morning. 5. A nurse enters the room of a patient who is on cardiac monitoring, complains of not feeling well. What is the most likely interpretation? Sinus tachycardia, B. Ventricular fibrillation, C. Normal sinus rhythm, D. Ventricular tachycardia. The answer is option D, ventricular tachycardia. 6. The physician has ordered mannitol for a client with a head injury. What should the nurse closely monitor because the client is receiving mannitol? A. Deep tendon reflexes, B. Urine output, C. Level of orientation, D. Pulse rate. The answer is option B, urine output. 7. The nurse who is caring for a patient with tuberculosis should wear A. N95 mask, B. Surgical mask, C. Cloth mask, D. No mask is required. The answer is option A, N95 mask. 8. A 45-year-old woman is receiving chemotherapy for breast cancer. 2 weeks after the initial treatment, she telephoned the nurse at the cancer center and reports she has hair loss, nausea, tiredness, a body temperature is 38.1 C, and air hunger, which finding most likely indicates that she needs to report the clinic. A. Pyrexia, B. Nausea, C. Hair loss, D. Air hunger. The answer is option D, air hunger. 9. The nurse is preparing to transfer a 55-year-old patient to the CT scan unit. The patient is too heavy for the nurse to transport, so the nurse went to get an assistive device to transfer the patient. Which of the following transfer device is the most appropriate for the nurse to use? A. Board. B. Handle. C. Trapeze. D. A mechanical lift. The answer is option D, a mechanical lift. 10. Which of the following organisms is the most common cause of urinary tract infection? A. Klebsiella. B. Staphylococcus. C. Escherichia coli. D. Pseudomonas. The answer is option C, Escherichia coli. 11. A newly joined RN is about to remove a nasogastric tube of a client with Guillain-Barré syndrome. To determine the proper time of removing the tube, the nurse should do it when A. When the client feeling hungry. B. When the client want to remove it. C. When the client totally conscious. D. When the client exit flatulence or gases. The answer is option D, when the client exit flatulence or gases. 12. Which of the following factors is the underlying cause of dystocia? A. A nutritional. B. A mechanical. C. Environmental. D. A medical. The answer is option B, a mechanical. 13. Which type of study design provides the strongest evidence? A. Qualitative study. B. A randomized control trial. C. Systematic review of descriptive studies. D. Systematic review of correlational studies. The answer is option B, randomized control trial. 14. A nurse is developing a plan of care for a client experiencing dystocia and includes several nursing interventions in the plan of care. The nurse prioritizes the plan of care and selects which of the following nursing interventions as the highest priority. A. Keeping the significant other informed of the progress of the labor. B. Providing comfort measures. C. Monitoring fetal heart rate. D. Changing the client's position frequently. The answer is option C, monitoring fetal heart rate. 15. A nurse in postpartum unit is caring for a client who has just delivered a newborn infant following a pregnancy with placenta previa. The nurse reviews the plan of care and prepares to monitor the client for which of the following risks associated with placenta previa? A. Disseminated intravascular coagulation. B. Chronic hypertension. C. Infection. D. Hemorrhage. The answer is option D, hemorrhage. 16. A 45-year-old man who is hospitalized feeling constant need to keep things in order, particularly whilst eating. The nurse observe him arranging the food on his plate into symmetrical and equal bite-sized pieces that he constantly worries that the food served could be out of date and potentially causes illness. Which nursing diagnosis is most important? A. Ineffective verbal communication. B. Self-esteem disturbance. C. Impaired social interaction. D. Anxiety. The answer is option D, anxiety. 17. The nurse is assessing a child who has tetralogy of Fallot and observed that the child is having clubbing in his fingernails. Which of the following might be the reason for this clubbing? A. Prolonged tissue hypoxia. B. Delayed physical growth. C. Inactive bone marrow. D. Pulmonary fibrosis. The answer is option, prolonged tissue hypoxia. 18. Which vitamin promote wound healing? A, B, C, D. The answer is option C. 19. In a postoperative patient in the surgical unit, most indicative of a developing complication is A. Increasing alertness. B. Weak and rapid pulse. C. Negative Homan sign. D. Minimal bowel sounds in 4 quadrants. The answer is option B, weak and rapid pulse. 20. Which patient should the physician need to see first? A. Female first para has difficult for breastfeeding. B. Patient has appointment for electrocardiogram. C. Patient newly diagnosis with hypertension for stress test. D. Patient complained chest pain after went for toilet bowel movement. The answer is option D. Patient complained chest pain after went for toilet bowel movement. 21. While taking the history from a new patient, the nurse identified that he had hypomanic episode which was alternating with a mirror depressive episode for the last 2 years. What is the most likely diagnosis? A. Bipolar I disorder. B. Bipolar II disorder. C. Dysthymic disorder. D. Cyclothymic disorder. The answer is option D, cyclothymic disorder. 22. When ventricular fibrillation occurs in a CCU, the first person reaching the client should A. Administer oxygen. B. Defibrillate the client. C. Initiate CPR. D. Administer sodium bicarbonate intravenously. The answer is option B, defibrillate the client. 23. A nurse is assigned to care for a Muslim female during emergency cesarean section. The patient asks them to allow to wear a head scarf during the surgery. Which of the following is the most appropriate response? A. Ask the patient to remove the scarf. B. Tell the patient that it is okay to wear the scarf. C. Ask the patient to wear a surgical cap. D. Tell the patient that a request will be during the surgery. The answer is option C. Ask the patient to wear a surgical cap. 24. The nurse is performing a physical examination to the client with hearing difficulty. The nurse activated the tuning fork and placed it on top of the client's head. What test did the nurse perform? A. Whisper test. B. RINA test. C. Audiometer. D. Weber test. The answer is option D, Weber test. 25. A nurse is trying to secure a peripheral 4 access in a traumatic patient who is deteriorating. The nurse has 2 failed attempts. What should the nurse do next? A. Activate code. B. Use interosseous needle. C. Consider arterial line. D. Call another nurse who is more experienced. The answer is option D. Call another nurse who is more experienced. 26. A student nurse is learning to assess blood pressure. What does the blood pressure measure? A. Flow of blood through the circulation. B. Force of blood against arterial walls. C. Force of blood against venous walls. D. Flow of blood through the heart. The answer is option B. Force of blood against arterial walls. 27. To decrease the anxiety of a 10-year-old girl who is undergoing surgery, which of the following should the nurse do? A. Use a heart model to show her how the surgery will go. B. Provide her with verbal explanation of the upcoming surgery. C. Give her a book to read about the surgery 2 weeks prior. D. Let her parents talk to her about the importance of having surgery. The answer is option A. Use a heart model to show her how the surgery will go. 28. AVI citing family member informs the psychiatric nurse that another patient is being sexually inappropriate with other patients. The nurse tells the visitor to inform that patient's nurse. Which of the following describes the nurse's actions? A. Practical. B. Negligence. C. Organized. D. Delegation. The answer is option B. Negligence. 29. Which of the following patients the nurse should see first? A. Patient complaining of muscle aches and fever. B. Patient scheduled for electrocardiography. C. Patient newly diagnosed with hypertension. D. Patient with complaints of chest pain. The answer is option D. Patient with complaints of chest pain. 30. While caring for a 3-day-old neonate who is receiving phototherapy to treat jaundice, the nurse in charge would expect to do which of the following? Turn the neonate every 6 hours. B. Encourages the mother to discontinue the breastfeeding. C. Notify the physician if the skin becomes bronze in color. D. Check the vital signs every 2 to 4 hours. The answer is option D. Check the vital signs every 2 to 4 hours. 31. What is the most appropriate blood product for a patient with hemorrhage due to upper GI bleeding? A. Plasma. B. Whole blood. C. Packed red cell. D. Serum albumin. The answer is option C. Packed red cell. 32. The first thing that a nurse must ensure when the baby's head comes out from the vagina is A. The cord is intact. B. No part of the cord is encircling the baby neck. C. The cord is still attached to the placenta. D. The cord is still pulsating. The answer is option C. The cord is still attached to the placenta. 33. A new community nurse in the rural clinics has to have good background about the health status of the community in order to assess their needs. What is the appropriate way to assess the health status of the community? A. Home visit. B. Community assembly. C. Mass information campaign. D. Community health assessments. The answer is option A. Home visit. 34. The nurse is assessing a pregnant client in the second trimester of pregnancy who was admitted to the maternity unit with a suspected diagnosis of abruptio placentae. Which assessment finding should the nurse expect to note if this condition is present? A. Dark red vaginal bleeding. B. A bright red vaginal bleeding. C. Painless. D. None of the above. The answer is option A. Dark red vaginal bleeding. 35. Which of the following patients is most appropriate to delegate to a nursing assistant? A. Insertion of an oral airway. B. Changing postoperative dressing. C. Initial interview on a newly admitted patient. D. Repositioning a patient to side-lying position. The answer is option D. Repositioning a patient to side-lying position.
Thank you for watching.